Good afternoon. I'm going to speak on how to start ophthalmic practice. As the previous speakers has rightly pointed out that there are many options are available today. But if you want to start, if you have decided to start private practice, then you need to be hard worker. You should enjoy seeing a lot of patients every day. You should able to handle stress, and you should able to do multitasking. So, so most of the ophthalmologists today are still involved in the private practice, and many corporate chains, large institutions, they started their beginning with private practice. So when to jump in? Once you are happy with your training, it's very important to have good training. So competence is must. Once you have good training, you are you are able to start private practice after having good training. So the next question is where to start. You need initial referral base. It's better you can start in your hometown. If you want to start in bigger city, there are more options are available like expansion, collaboration, sharing, and mergers, etc. And before starting your practice, it's good idea to visit a senior ophthalmologist and observe him for few days, so you can have a feel of it. And how to start? As I mentioned before, that it's very important to have good surgical training, because if you start your practice and if you deliver the good results, then only the patient will come to you. And there are few things which you need to keep in mind about location. And building your team, you should get a good trained staff, and so that you can delegate them the job and you can supervise them. And you should consider buying good equipment. You can talk to the company, form a group, and then you can have better negotiation with the company. Try to establish your system so that it can run smoothly. And try to build up protocols, checklist, so that there should be minimal possibility of an error. And you just see the rules and regulations so that you can start working without any problem. And very important to create awareness. You can do awareness about image building by celebrating important days and by participation in local Indian Medical Association meeting. You should actively take the feedback. And customer satisfaction, I mean patient satisfaction, is absolute must in order to become a successful practitioner. So this is the checklist which I have mentioned. You can start working, doing your homework after finishing your fellowship 6 months in advance, and then this is the checklist which you can consider 3 to 4 months in advance. This is, you can do 3 to 4 months, like diagnostic equipment, office furniture, and policies, and once you start, then you prepare the inauguration of your practice. You can start announcement of your practice. And so the important take-home message is that there are no secret to success. It is a result of preparation, hard work, and learning from the failure. And it's very important to keep in mind that you should have very good competence in ophthalmology. And this competence with excellent interpersonal relationship and management skills would score you, better in achieving and generating lot of cases. Thank you so much.